and I am the course director for MCh Orth Dundee. I'm also the head of department for orthopedics academic department here in Dundee, and I'm a consultant orthopedic surgeon in the NHS Tayside. Today, what we'll do is we'll go through a little bit of information about the MCH, how the courses run. We'll also go through some teaching styles and what we teach, what you'll do when you come here in MCH, and I'll try to briefly take you through the journey, one, how to apply and where to apply and what options you have. And then we'll get some information from our alumni, and then we'll have some time to answer some of your questions. I know there will be hundreds of questions, but it'll be difficult for us to answer all the questions. But I'm hoping many of the questions will be answered from my presentation and some of the presentations from the other colleagues. So I'm hoping this session will probably last no more than an hour, but and then you'll have an opportunity thereafter to post your questions, and we'll come back to them soon as. We got today, Rosemary is our course administrator. So she will, when you come here, she'll be looking after you. We have Michael Penman, who is the university admissions person. And Michael will, once you apply, Michael will be the person who will be engaging with you, helping you to make sure the documents are right. You quickly get your cast letter, get all the documents that you need for your visa, and you safely arrive. Also, we have Ross, who is our administrator here in the University of Dundee. You already met Dandan, and then Ravi and Vandana are from Quest from India. Both of them help for any questions or any issues that you have when you're applying from India. So they'll be helping. So again, they are here. If there are any specific questions, they can carry on. You can catch up with them either locally or through emails. We are very lucky today that we have two MCH alumni, Amna and Rahul. Both of them have recently passed MCH, so they'll tell you about their experience, because I can go on for ages telling how good the course is, but you should hear it from the people who have done it. Interestingly, I did the course in 2002, and 20 years down the line, I'm the course director now, so it can't be that bad. Okay, with that little note, let me start my presentation. Sorry, there's some
technical issues.
no, it's fine. I think it should be okay. It's just taking some time to load.
Great.
It's 2 seconds. Can you see this?
I can't see it now. It's nothing show.
Okay. Give me a second again. Any luck?
Yeah.
Yeah.
It's not the full screen yet, but we can see the slide.
Can you see the full screen now?
We can see the full screen, but we also can see the next slide.
Okay. How do I go that? Take it away.
If you don't want to show this way, and then you can deduct from your docking station, that should and reopen the slide again, and it wouldn't show this format.
Give me a second. Okay, let's go. I think we'll be okay. Okay, so as I said, I'm Professor Arpit Jariwala. I'm the director for the University Academic Department here at Dundee, and also the director for MCh Orth course. So I'll be handling all your applications and meet you when you come here. MCh Orth course has been running now for nearly 34 years. Successfully, we have more than now to 430 alumni, and you will meet a lot of alumni across India and other areas who are all senior orthopedic surgeons, and many of them are now presidents or vice president elects for various orthopedic associations or subspecialty associations. Where does the MCH Orth course happen? Everything happens in Dundee. You're not running around different areas. There are some other courses where you're traveling miles to reach different hospitals, but everything is one go. This is a Nine Wells Hospital. It's one of the largest hospitals in Scotland, where you have it's a polytrauma center, and you have the orthopedics and academic department and A&E all next to each other, so that your learning and teaching and clinical training can all go on hand in hand, and you're not running around things. Now, what is the course structure of the MCH Orth course? The MCH Orth course is basically consists of three main areas. One is your teaching, which is your clinical orthopedics and allied subjects. The second one is your research project, which is very important as it's a master's course. And the third most important thing is your clinical experience, which is in NHS. Now, we are very lucky for the last, probably when I started, we got permission from GMC for us to scrub up and assist theaters. And we you'd be allowed to observe, assist in scrub up in theaters in various surgery, trauma, and elective in various subspecialties. So you're not just sort of learning in the classroom, but you're learning in theaters, wards, trauma meetings, clinics, fracture clinics, plastron, everywhere you're learning. And of course, if you come for a course, you'll have assessments. So teaching happens in different ways. It can be a big classroom teaching. Some of the lectures will be like that. There'll be individual teaching. There'll be group teaching. There'll be anatomy teaching in the anatomy department. There'll be also you have a big Nine Wells medical library, which has access to hundreds of orthopedic journals. So you can read and learn from them. The teaching is all done by a selected group of orthopedic surgeons. These are all consultants who have at least 3 years or more of orthopedic experience, and they're all subspecialists. So we do not engage with faculty who are not subspecialty trained. So you'll have people who are shoulder surgeons, knee surgeons, hip surgeons, foot and ankle surgeons, pediatric surgeons, spine surgeons who come and teach you. The teaching is split. Most of the teaching is face to face, where the lecturers will come to you to teach. But some of the excellent faculty that we call from across the United Kingdom and across Europe and India, they're all online teaching. The workshops and seminars all will be small group teaching and face to face. So let's look at what the semester looks like. So this is one of the weeks where you'll have teaching on rheumatoid arthritis. I'll be teaching you on clavicle fracture and what's the evidence around it. Dr. Tim Drew and Dr. Vijay Wang will be teaching you on motion mechanics and statistics. One of the surgeons from Aberdeen will teach you about shoulder arthroplasty. One of the hand surgeons will teach you around surgical management of spastic hand deformities, and one surgeon from Glasgow will come and teach you on on elbow instabilities, complex fracture patterns around the elbow. So it's a very, very busy week, but it will not end, because on Friday I'll come back again to teach you about shoulder replacement principles. So that's how your week will look like. And now what we have done is that in the morning you'll have your clinical attachment. So you start your day at 8 o'clock with trauma meetings, where we discuss all the cases that have come in over the last 24 hours, and we'll discuss what's the best management plan for them. And then you go and attend your clinics, theaters, wherever you're slotted to. And afternoon is the teaching. Another week of MCH teaching, where I'll teach you about distal biceps and pec major ruptures. One of the surgeons will teach you about pediatric trauma and their management. One of the senior shoulder surgeons in UK, Simon Lambert from Stanmore, he'll teach you about complex shoulder instability. And again, you'll have plastic surgeons teaching you how to manage defects and open fractures in trauma patients. When we come to semester 2, which is mainly hip and knee, spine and foot and ankle, again, you see it's a very busy period where you'll be learning about degenerative spine, learning about planning of complex knee arthroplasty, including revision arthroplasty. One of the surgeons will bring interesting lower limb trauma cases to discuss with you. You'll have spinal deformity. Anesthetics will come and tell you about day surgery, hip and knee replacements. and you'll have foot and ankle and other types of lectures. So it's a very pretty busy timetable, and this is the teaching will be at a level which is beyond MS Orth. The faculty is all, as I said, they're all surgeons, at least more than 3 years of consultant job, and they are from different parts of the UK. Many will be from around Scotland. One of the things that we pride in Dundee is the Thiel cadaveric sessions. These are specially embalmed cadavers that are very lifelike, and you genuinely enjoy learning on them. We have also introduced from a couple of years ago anatomy revision. So a lot of you have not, I'm sure, have not revisited the anatomy lab since you left your medical school, and it's a good time to revisit anatomy. So again, we'll do some workshops in the cadaveric sessions. We'll do one-to-one teaching, anatomy revision. So there's a lot of work that goes on in the anatomy labs. Some of the, as I said, there's anatomy cadaveric sessions. I'll run the upper limb approaches, and I'll tell you how we do a shoulder replacement, how we do a cuff repair. Then we take you through common hand and wrist procedures like carpal tunnel, Brunner's incision, dorsal approach to the wrist, denervation of the wrist, UCL injuries. In the second semester, you'll have hip and knee and foot and ankle courses and cadaveric spine course. So whole of your orthopedics will be covered through cadaveric courses. We also do dry bone workshop, which is for pediatric spinal management for scoliosis. So one of the senior surgeons, pediatric orthopedic surgeons, who is the chair for spinal deformity, he comes and brings models, and you practice on them. We also have motion and gait analysis workshop, and we'll do the pelvic and acetabular trauma symposium, which is a worldwide symposium that we hold every year, where the surgeons and experienced surgeons come from across the world to teach you. So I think it's important to see how we teach. We don't give you just notes to study. It'll be more case-based scenario teaching, where I'm telling you describing you a case, and then ask you the questions, and then you think. And basically, the aim is to uh, in, improve your decision-making process and make sure that you are thinking on the right direction. So this is a lady who was quite big. She was 108 kilos, fell, injured. She was initially discharged from the hospital with query elbow soft tissue injury to the elbow. One of the other surgeons saw her and thought elbow did not look right. So spoke to me, and I said, let's get a CT scan. And we got a CT scan where if you can see, there is a radial head fracture and a coronoid fracture. So this is quite a complex injury. And then when we discuss, we'll tell you how we approach this, what approaches do we use on the medial side and on the lateral side to fix this patient. And this is what I did for this lady. We had to put a coronoid plate, had to fix the radial head, and then we had to repair the ligaments as well. And she did well. Another case, this is a patient who was referred to me for locking of the shoulder joint. And again, it was treated like a calcific tendonitis, but this is not calcific tendonitis, because when you get the MRI, it shows multiple loose bodies. And the diagnosis for this one was a synovial osteochondromatosis. And for this one, we did an arthroscopic excision of nearly 170 loose bodies were taken out. And this is now, I think, 8 or 9 years ago, this case happened, and he's still doing well and has not come back. Another case, this was a few weeks ago. Patient came in. This plate has been there for 11 years. And one of the surgeons went in to take the plate out, could not take the plate out because the plate, as you know, some of these titanium plates can weld in, and it was welded in. So he's been referred to me for further management. So again, difficult case. You have to think laterally, how do we fix it? What do we do with it? And these are the things that we'll be start to make you think and get answers for. Another case, this was recently referred to me a couple of weeks ago. Again, this was discharged from A&E. He fell off a motorcycle, quite a heavy injury, and was discharged. A lot of bruising around the shoulder, unable to move the shoulder, was thought to have a soft tissue injury and discharged. I saw him back and got only one X-ray was done, and got another X-ray, and it shows a fracture. I personally thought this was a glenoid fracture and got a CT scan, and I was surprised that this was a complete avulsion of subscapularis, which is very rare. It is the second one I've seen in my 15 years of orthopedic upper limb orthopedic career. And what we did was we went in and fixed it with a couple of screws through a deltopectoral approach. So this is the level of teaching we are going to do. It's not going to be what do you do with this ankle fracture or wrist fracture or a hip fracture. No, I've told you a lot about the upper limb because I am an upper limb surgeon, but this is another case where this patient had a total hip replacement done 4 years ago, did well for about 2 years, and then started dislocating. And this is her fourth dislocation she came in. And then we go into the discussion of with the hip surgeons whether we revise it. What do we revise it? Do we revise just the stem? Do we revise the whole cup? Is it infected? Or do we do a captive liner? So these are the discussions that will happen when the hip surgeons are teaching you. Again, this is a relatively young person. She is 62. She has mild rheumatoid symptoms, fell off 9 stairs and fractured her knee. Now, do we reconstruct this? We don't know. We got a CT scan which looks mush. So, or do we do a primary knee replacement? What are the techniques for primary knee replacement in a fracture scenario? Do you use the stemmed implant or not? And how are the results of it? And again, this is a discussion that will happen when the knee surgeons come and teach you. Another patient, this is a footballer. He is a celebrity, had football tackle on field, playing a championship game, came in and leg was very swollen. It was a closed injury. And again, we'll discuss about how do we measure compartment syndrome, what are the indications when you need to go and decompress it. And if you have to decompress it, how do you decompress it, making sure you don't cause more injury by injuring the perforators. And again, foot and ankle surgeons will come and teach you about complex foot injuries. This is a laborer that was run over by a big truck and sustained this nasty injury to his foot. He came in with blisters. So what do we do with the blisters? Do we de-roof it? Do we go in and straight away fix all these, or do we keep it? What is the risk of amputation in this guy? So these are things that we'll be discussing with you. So that's the level of teaching that we'll be teaching. So all the almost all the teaching will happen on case-based scenario. There'll be nothing. We'll not be telling you classification because from as an MS Orth or a DNB Orth or for after years of practice, you should know that. So we'll be making you to think on difficult cases. How do you make difficult decisions? So that's the first part of it, which will be the teaching. The second part is research. And for MCH, you'll have to do a research project, which will be a desk-based project. And we have a lot of data for hip, knee, shoulders, foot and ankle, soft tissue knees that you will be given and you'll work on it. There'll be some pilot study looking at some volunteers. But once you come in, there'll be a few projects on offer. And if you had a project that you wanted to offer, we can discuss that as well. We have a very busy lab as well. We do a lot of gate work. And if you look at Dundee Gate Lab, you get a lot of things. We do a lot of things with ambulance and extractions and kinematic analysis. So again, these are some of the projects. If you're interested, you can get involved in. Some of the projects that from the last few years we looked at was metal on metal resurfacing. We looked at midfoot fusion. We looked at constrained liners in total hip replacement, looked at outcomes of reverse shoulder replacement, and changing saddle tilt on lumbar spine kinematics and cyclists. So again, a wide variety of projects that you get. We are very keen on you presenting and publishing across the world, and we love a couple of years ago, we had 10 publications out of in a 1 year. Our alumni, even when they finish, they continue to publish. And since 2019, there have been 33 publications just from our alumni, not from the department, but from our alumni. So the projects are very good and they are to a standard. If you do it well, then you will be able to present it locally in India and also internationally and also publish it, which is always adds to your CV and to your career. So finally, coming to the NHS attachment, which is what most of you are coming on to see and learn. So as I said before, you'll have access to, once you get your occupational health done, you'll have access to clinics, you'll have access to theaters, you'll have access to wards, you'll have access to trauma meeting. So the day starts with the trauma meeting where we all discuss the cases, and then depending on who you're attached to, you'll go to wards, clinics, theaters, or trauma go to the as multi-speciality meetings. In terms of who do you attach to when you come here, we'll ask what your preference is. Do you want to work with somebody in a field that you have not experienced before? So some people want to work in things they had not seen before, like shoulder, foot and ankle, or pediatric orthopedics, but some want to just cement what they want to do in life, like hip and knee revisions, or soft tissue knees or spine. So accordingly, we'll attach you to a clinical supervisor who will be with you for the next 9 months. You'll be attached to him and you'll attend all his sessions, including theaters, clinics, MDT meetings, trauma theaters. We have now 22 orthopedic surgeons. We appointed two more, which will be joining by the time you come. And we cover all the subspecialties, including arthroplasty, in revision arthroplasty, pelvic and stapler reconstructions, revisions, pediatric, upper limb, foot and ankle, spine, young hip, including pediatric young osteotomy, hip arthroscopies, and we have a plastics and hand two consultants. So anything that you wanted to see is available here. So, as I said to you, we are one of the major polytrauma centers. So we get about 6 to 7 polytraumas a week, and sometimes we get 2 or 3 in the night. So you'll see a spectrum of injuries across multiple patients with polytrauma. We also this year we also had patient anesthetists coming and speaking to our students, looking at damage control surgery. How do we manage patient in ICU? How do we get them ready for anesthetic challenges? So again, these are important because I'm told that in India now polytrauma is increasing as well. And as I said, you'll have the whole spectrum of orthopedics to look and see from. And depending on what your preference is, we can attach you to spine, hip and knee, upper limb, whichever you wanted to go, or pediatrics for that matter. So after all that good news, you will have your assessments. So you'll have MCQ in semester 1 and semester 2, which will be online, and then you'll have your thesis presentation, and you'll have your mini essay or OSCE, which is clinical vivas in the end of May before your final exams. So that's the part of your getting your degree. We have run this program for now 34 years, and we have a very supportive staff. They understand that you come from India, you're exposed to a new environment. Some of you have not presented before, some of you have not written thesis before, and so we are all here to help you. So please don't worry. We have all worked with different ability of students to come here. So and accordingly, we will gauge you. Everybody is very helpful here. So how can you apply? So what we need from you is the people we need postgraduate degrees. So if you have an MS Orth or a DNB Orth, you can apply. If you also have a D Orth and 4 or 5 years of experience in orthopedics, we can consider your application, although this is not our primary area of concern, but we will need your CV, and we'll need some references. People who are just MBBS, we have an MSc Orth pathway where you can do the MSc Orth and then gain some experience in India before you come and do an MCH. So all these are available. Once you write to us, we can advise you. What happens after you finish your MCS? Most of you will go back home and from India or wherever you are from, and then start practicing. Some of you would want to do short-term fellowships. So for the last 4 or 5 years, we have short-term fellowships, and these are basically from 2 weeks to 12 weeks, where you can gain more skills with one of the specific specialities that we have here in Dundee. And because during the course you don't get a full through sometimes you can't get a full through experience because you're studying, you're doing your thesis, you're going listening to lectures, and then you're going to the clinics and theaters. After the MCH, you'll have the opportunity to work for 2, 3, 4, 6 weeks with a surgeon and to gain more skills. And that is available, but we can discuss when you come here. Some of you, like Rahul and Amna, will want to stay back here, and the options for MRCS and PLAP is there. And after that, we help you out, guide you, give you career advice for UK jobs. From my understanding, for the last 15 years, I've been attached to MCH Orth. I've not seen anybody who wanted to work in UK has not worked in UK after MCH Orth. It is not you go through phases of being easy and difficult, but you always get a job if you do your exams well. So what happens? This is if you are interested, you need to go into this website. I would recommend everybody who's on here take a picture of a snapshot of this, because this is our orthopedic website. And once you go in there, you will be able to apply for this course. There will be a chat box where you can ask some questions, and we can get back to you to answer some of your questions. But I'm hoping many of your questions would have been answered from my presentation. So once you apply, the fee for this course is 27,000, nearly 28,000 pounds for the coming year. But the good thing is that if you apply early, there are a lot of scholarships that you can get, which will reduce your fee. Now, these are mainly for the Southern Asia people, which is India, Pakistan, Bangladesh, Sri Lanka. We have the Vice Chancellor's Regional Scholarship. We have Community Scholarships. We have the Global Excellence Scholarship if your marks are good from your previous study. And there are also some Scotland-wide scholarship, which are slightly difficult to get because they are competitive, but you can apply for them. I know of 3 or 4 people in the last 8, 9 years who have applied for that and got good scholarships. So these are first come first, and you need to apply. You need to be on this. You need to apply and be accepted on the course, and then you can apply for these scholarships so that that can reduce your fee. Well, full stop. So we can talk about that later on as well. So once you apply, you will be asked for your qualification, your grade, your documents in terms of your degree certificate, both for MBBS and MS, or DNB or DAuth. And then we will need an evidence of your English language tests. So if you look at the website, they'll tell you what English language scores we need. It is not difficult, and we normally don't see people having a problem with English language test. We will need a CV, short CV of you. And in most cases, we'll need an academic reference, especially if you're applying, if you don't have an MS or DNB or from before. And also we'll need a personal statement of why you are coming to this course. But this will all be explained when you apply. Once you apply, then the committee will have a look at the applications, and depending on if you have an MS or a DNB or you have your English language, then it'll be an unconditional offer. Or if you don't have your English language, or you're waiting for your degree certificate for your MS then it'll be a conditional offer. But if you don't have any of those degrees, or if you sometimes the physios apply for these courses, we'll uh, guide you to where to apply for a different course, but will reject you for MCh Orth. Once you get an offer of conditional or unconditional offer, you can accept it, and then we'll start that's where Michael gets involved, and he'll start the process for you to come over here, and we'll take you through the various things that you need to do before you come here. Also, the earlier you apply, the quicker you'll get into the accommodation, because accommodation can be issue. So I remember a couple of years ago, we had somebody who did not apply, did not confirm till the end. So he had problems with his visa, and he got delayed in coming, and he had no accommodation. So for about 3 weeks, he had to live in a hotel. So we don't want you to have any stress. Our aim is to make your journey from India to here comfortable, so that you can do your course in a good mood. So what happens after the course? As I said, I'm a good example of the course. I completed the course in 2000, and I finished. And then I went down, cleared my exams, and then went down to London to work, and then slowly made my way up back to Dundee. Many of our graduates, MCH, as I said to you, are now senior orthopedic surgeons in various private hospitals. Many of them are now in various orthopedic associations, and we have an alumni group which is for about 400 alumni that we regularly keep in touch with, and some of them who are doing groundbreaking work, we bring them back here to give us lectures. Again, if you want to study in UK, then you can pass your MRCS and PLAB, and then we'll help you to and give you career advice accordingly. Also, many of our students, after completing MCH, they go on to go to Europe for short-term fellowships, because they want to specifically learn something specific. Say example, you wanted to learn about how do you manage infected hips, you'll go to endo clinic, and we give you a reference from the department, which is a good reference, so that you get the fellowship. So I'm hoping that helps. And again, when you come to Scotland, Scotland is a beautiful country. This is now home for me for the last 20 years. many areas to walk, travel, enjoy, and also when you come here, you'll meet a variety of people, lots of students in the department, so you make new friendships, and then you get a well and renowned degree, and then you return home. We'll see what Amna and Rahul have to say about their experience, but this is one of the couple of feedbacks we got in 2022, 2023. So I'll leave it for a minute for you to read. So most of the students who come here, they feel that the course has helped improved them from where they started, their decision-making skills, their clinical skills, their thought process, and the way they approach a patient has changed, and that helps them in their career ahead. With that little note, thank you very much. Okay, so I'll just invite few people before we open it for questions, Dandan.
Yeah.
Uh, Michael, did you want to add anything? Can't hear you, Michael.
Is that better?
Yeah.
Perfect. Right. Hi everyone. So as Arpit said, my name is Michael Penman and I'm an admissions officer here at the university. There's not too much for me to add here, as Arpit's covered basically everything already, which is good. But after today's session, do you have any inquiries that you have regarding the course, gain entry, join us here in Dundee? If you email those in to contact us, which you can find the details for on the website, I'll pick those up for you and I'll get back with all the relevant information for you. It's very nice to see so many of you today, and we'll hopefully see you with us in September this year.
Me, Michael, Rosemary, we meet weekly. So any issues that you'll have will be updated, and most of the time we will. Michael and Rosemary have answers to all your questions. There's very little that comes to me unless it's mostly it is a degree issue where they don't understand what the degree is. But now Michael and Rosemary have a very good insight of India and the Indian degrees. So usually they'll be able to answer straight after your email. So, Rosemary, you want to say anything? Thanks, Michael.
Hi, no, I don't really have anything to add, Arpit, just that we hope to see you in September 2025.
Yes, good. Okay, thanks. Okay, so I think probably it'll be nice to get Rahul in if he's around. So Rahul is one of our MCH alumni, and I'll just ask Rahul to okay, Rahul, just tell us about what you felt about the teaching that we deliver, and maybe if you can touch on the Thiel cadaver courses, how you felt they were different from your own anatomy days, where we used to use the formaldehyde ones.
Sure,
Yeah,
definitely.
thanks.
Yeah, thank you, Prof. Actually, it's absolutely a privilege to talk about the department as such, entire department, and it's a totally different experience altogether, which I had after coming from India or getting my postgraduate degree of orthopedics from India, and the kind of teaching that is offered here was completely different. It's a class apart. As Prof mentioned earlier, that these teachings, especially the lectures and stuff, they are not just like somebody's delivering and you're listening or making notes. It is absolutely interactive. And the first few lectures, even I was intimidated a bit when I couldn't answer the things at level which was more than what MS diploma, a DNB auth or something, they just talk. And this sets its own standards apart. I mean, I was completely taken aback. Plus, not just orthopedics, if you guys are into publications in India as well, which we have enough data, then these lectures on research and statistics by other renowned teachers is equally important to go ahead. And when the best part was about when Prof just mentioned about it was the Thiel cadavers, the Thiel embalmed cadavers, which is there in the Cahid lab. And I don't remember when was the last time after my anatomy first, second year, I had visited the cadaver lab and I actually dissected the brachial plexus. I mean, that was amazing for me. And I mean, this is something I don't think a lot of institutions are. There's one of few institutions, or maybe I just feel it is only Dundee which can just offer this kind of realistic tissue preservation. And then you have excellent teachers. Obviously, Prof is there, as well as you get fantastic teachers like Mr. Simon Lambert from London, who has co-authored in Gray's Anatomy about the neural pathways of shoulder. I mean, this is absolutely a different class and a different way of experience. Yes, on top of it, yes, you start your day at 8 if you want, and then even if you can be with your consultants whom with you're attached, or your own interest. You can even work on weekends, be on call, and learn by in the theaters. The theater staff is wonderful and everything. I would just say, yes, this is something I was fortunate to get into MCh Orth course and enhance all the skills and things which I could learn as much as possible. And yes, the exams are there, and they are not to be taken lightly. Anyway, I mean, that's about it. I would like to tell. I mean, back over to you, Prof.
Thanks, Rahul. That's very nice to hear all that good comments. So, and genuinely, I did not prime Rahul, so he said what he wanted to say. Thanks, Rahul. Okay,
Thank
we'll
you.
get Amna now.
Hello, yes, sir. I'm
So
audible.
Amna, everyone, Amna is one of our alumni. So I'm very proud of her, and because she is one of the few female orthopedic surgeons that came in. She had a very young infant baby when she came in. So she was managing MCh Orth course, managing a baby, and did her course pass. She also cleared her MRCS and is now got an orthopedic job in NHS Tayside. So I just feel very happy and very proud that she's from MCH Orth Dundee. So luckily I caught her in the corridor. So I said, can you please come and say some few words? So Amna, just tell them about your experience and your journey. Thanks.
All right. Hi, good afternoon, everyone. Am I audible? All right. So I'm Amna, one of the MCH alumni. I did my MCH in 2023. And I've done my MS orthopedics, MBBS and MS orthopedics back from India. Then I shifted to UK, did my MCH orthopedics. And with the MCH orthopedics, I was able to clear my MRCS with the help of MCH. I can guarantee you for that. All right. So regarding this MCH course, it has not only deepened my clinical skills, but it has opened, I can say that many doors for me in the world of orthopedics in UK to establish a career here in UK. So as Professor Jariwala has beautifully portrayed what happens during the course and things which I don't think I can explain better. But yes, my experience was definitely great about the surgical skills, about the academics, about the sessions. They are so interactive. It's not like they're going to teach you the classifications and the things like that. It's the case based, and it's like, wow, it's such a great experience. And the thing that I was scared of was the research work, because back in India, we are not, exposed to research work much. But at every step, I can guarantee you for that, you'll get the help, and you'll be able to complete your research work. You'll have somebody to help you with the stats, with collecting the data, doing at every step you'll have somebody to help you with. So that was not at all an issue, which I thought might be difficult for me. Plus the cherry on the cake, I would say, the NHS attachments. Yes, so we could scrub in and get into theaters and see what actually happens in UK. That's something so exciting for me to see coming from India, and where obviously I was not given much opportunity back in India, being a female orthopedician. But I had a very good experience here in India, and I saw all the great surgeons, all the orthoplasties, arthroscopies, and all the surgeries that I thought would be, I'll never be a part of one. Anyways, like the conclusion is this course helped me a lot. A lot means a lot to reach here. And plus, yes, there was a big hurdle that I want to discuss is my baby. Yes, I had 18 months old baby when I came here, and there was a point when I thought I won't be able to make it with the baby and the course. But at every step, all difficulty, all the people, they helped me and made it possible for me to get through this and yes, complete the course. And thank you so much once again for helping me with the course and reaching here. And during my MCH, one thing I learned was when I was preparing for my MRCS, there were like many things which were when I went to the exam, there were so many things which I learned in MCH orthopedics which came in my MRCS exam. So it helped me a lot in clearing my MRCS exam as well. So once again, thank you so much, and definitely it's going to be a big highlight on your CV if you do this MCH course, which added to mine. And yes, all the best, and thank you so much for everything.
Thanks, Amna. Back to your ward work. See you. Bye-bye. Thanks a lot. Okay, Dandan. So
Yeah.
We can take some questions if you have.
Yeah, we do have many questions here.
So shall I just bring in Ravi just for a second because he's based in India as well.
Yeah.
So, Ravi.
Yeah.
Okay, if you just put your
Yes, hi.
Hi, Ravi. So Ravi has been very supportive of us. Ravi is from Quest India, Quest Healthcare from India. They're based in Mumbai. I had the fortune to meet Ravi and Vandana in Mumbai a couple of years ago, and so they help you. So people who have difficulty in getting the things organized in India, so they will be able to help you from there. And again, if you look up Quest Healthcare, they should be able to get to them. And I routinely speak to them. So again, if they have a question or a query, they can inquire from us. So we got it. As you see, we have a team that is helping you from India to UK and for the course. So everybody is supportive of you. So you just need to start making the inroads to do the course. Okay. Thanks, Ravi. Thanks, Vandana.
Pleasure.
Okay, Dandan.
Yeah, we have many questions here, but I think during your presentation, there are some questions that have been answered, but maybe there's no harm to answer again if you think it. The first question is from Fa, and please, I have a Bachelor of Technology in Biomedical Engineering. Can I also pursue this program?
So you need to be a doctor. You need to have an orthopedic degree to pursue this program, but we have a different program now called OMAR, which is Orthopedic Rehabilitation Technology. You can pursue that, and then if you then you can come over do that program, which is again recognized across India.
Thank you, Abid. We got next questions. Is the student basically is asking about the course duration and the expense and accommodation or any scholarship. I think this is all answered during your presentation.
The cost, as I said, was and then luckily Dundee is not as costly as London or Edinburgh or Manchester. It's a little nice town, so everything is close by. And accommodation, again, as I said, there are a lot of university accommodations, but if you wanted to live luxury wise, you can live luxury wise as well. And again, so the scholarship I've already told you about, so you need to apply soon to get it.
Is the same student asking the same, but I don't get it, and I think you probably would, and make sense for you. The student just have one word with question mark. It's called arthroscopy.
Yes.
Sorry?
I think whether we cover arthroscopy must be the question.
Yes. So Everything, anything that you think of in orthopedics is covered here. So
Right.
everything in orthopedics, as I said, pediatric osteotomy, arthroscopy, hip, knee, foot and ankle, elbow, shoulder, every arthroscopy is covered here.
We got next questions from Sid is eligibility criteria for this course.
I've already said, so either MS Orth or DNB Orth, or if you've done your D Orth, we need a few years of experience so that you are, and we will need some strong recommendation from some of your mentors.
We got next question is this course recognized in India?
Yes, it is recognized in most of the states in India, and what you have to do is you take your degree back to India to the medical council of your state and get it recognized.
Is it specialty or super specialty?
Yes. Where are you reading these questions so I can help you?
Is
I think
just
under question.
if you can open the Q&A,
Okay, yeah.
Q&A.
Okay,
and
fine.
then you can see there is we answered
So which one are you on now just now?
first one.
I think this is from Dr. Ajinkya
Ajink, yes,
Kampalkar.
okay. So it is a super specialty course. So it's MCH, it has to be super specialties. There is an exam, and students between at 9 months is the total duration, and there's no extension for that. But you can, if you complete it and you want to do your MCH post MCH fellowship, then you can do that. Where can we contact you? So the Dan will send you the link for contacting us. Yes, ID mail, yes.
Yes, I will
Yes,
let
for
know.
D Orth, we would recommend some experience post D Orth. So we do not take straight from D Orth. Short-term fellowship, yes, you have to be an MCH Orth in the MCH Orth course to be able to apply for these fellowships, because these are very specifically structured fellowship for your taste. The course is 9 months. If you're doing neurosurgery, I'm not sure how would you be interested in how would you get into orthopedics? Unlikely. How frequent is hands-on? It's every probably I would say 3 times a week. Cases depends on if I was doing a shoulder, I did a shoulder day before yesterday, it took 4.5 hours. So you'll only see two cases, 3 cases. So I don't think you should worry about how many cases, but you should look at the quality of cases. Yes, there is trauma, arthroplasty, arthroscopy of any joint that you're looking for. Scholarship, again, Michael will help you with the scholarship. What about other countries? I don't understand that question. How to apply for MCH as an MBBS. So MBBS, as we said, you need to do our OMAR course, which is a Orthopedic Rehabilitation Technology course, which gives you a postgraduate degree, and then get some experience in India or wherever you are as an orthopedic surgeon, and then you can apply for us. And we give you preference because you've done the course, the postgraduate degree from our course. Yes, that's fine, Suresh. You apply for the course, and we can look at your application. But the applications are already out for 2025, so you need to be doing it soon. Shivaram, D Orth, DNB Orth, FNB arthroplasty, and how to proceed again. Dan and Michael will guide you. Just apply, and then we'll get your application approved once I see all your documents. Dr. Agrawal, how much value does postgraduate experience in India help with future fellowships in UK? This is not, I think, none. I think they've stopped recognizing any experience from India in UK now. So I'm not sure about it, but this is not a part of. But yes, if you do the MCH, that will be recognized. There's no stipend for this course, unfortunately, because you're all the time learning and training. Mayank, yes, you've already applied. Yes, I remember you. So there is a lot of accommodation. There are hospital accommodation, which is just inside the hospital. But there are also hospital accommodation in the university. So once you apply, Michael will be able to guide you. Don't worry about accommodation, but as long as you apply soon, we'll be able to guide you. The problem happens when you suddenly rise up from sleep in August, and then you're starting to do everything, and it becomes very difficult. Which books do you need to carry? None. Just bring your laptop. MSN. Oh, you from BHU? You passed Prabhajan Agarwal. You from BHU? So that's my institute. Hello. And you're writing your MRCS. So you could apply anytime you wanted for the course. With MBBS, Dr. Vinod, we can't accept you because we need a postgraduate degree. I'm sorry.
I think Dr. Mayank is also asking about research work, whether it is mandatory.
Yes, so it's a master's degree. You'll have to do the research work. We try and help you to publish the research because that helps your CV and for further scholarships and fellowships and jobs. Yeah, I'm not aware of the MS Ortho from China, but if you apply and send your details, and we'll need some information about the China MS Orth, and we can then advise you. Is this course recognized in India? Considering fact, yes, this has been going on for 34 years, so it is recognized because this is a super specialty MCH course. 9 months. Yes, we have had students from Sri Lanka, Pakistan, Bangladesh, Middle East, Dubai, Africa. So yes, we have students from all over the places. The course starts in September. There's only one start. Some questions are getting repeated. Does the degree recognize? And so it is up to the student to get it recognized, but all of our students who go back, they have in their own individual state recognized in their own states. There is no exception to the English proficiency test. You will have to sit an IELTS or a similar sort of test. If you're from not from India, but from Afghanistan, Sri Lanka, Pakistan, you may have different special degree association, but we can check that. The university will check that whether it's equivalent or not. And yes, you can apply. I don't understand that you're applying through Chevron scholarship. Sure.
Professor, somebody's asked if the fee includes accommodation.
No, it doesn't. So you don't get GMC registration after MCH Orth course. You'll have to sit PLAB or MRCS like Amna did and like I did. It is not for just Indian nationality. We have students from this year. We have somebody from Africa, one from Bangladesh. Last year we had two people from Nepal. So Ireland, again, if you're working in Ireland, it helps. We have had quite a few people a few years ago. Every year we had somebody from Ireland who came and then they went on to the specialist training because you get a degree and you also get a research degree. You are able to publish and present, which are all points when you apply for surgical orthopedic training in Ireland. The National Medical Council has just been formed a couple of years ago. So from when it changed from MCI, so now they have recommended that you have to register all your degrees in your state. There is not a pan-India registration anymore. Does they have break? Yes, you'll have a little bit of break during Christmas time, but I normally recommend that you work on your thesis and gain more experience going to theaters and clinics. But if you have something urgent, you can go back to home and come back. Last, I think is Vinod. I'm doing fellowship in arthroscopy, cleared MRCS, got my GMC last. Yes, if you're applied, then you can get a scholarship, and there are various scholarships that are available. Again, scholarship, as I said, Michael is the person to guide you through. Okay. Is that all done?
Yeah, I think that's all. I just going to put Chevening scholarship information in our chat to everyone.
Yeah. And also put the sort of the MCh Orth Dundee website and a link for where they can get to some questions.
Right. Yeah.
And Prof, will this presentation be later on available anywhere? Because there are a lot of people who have missed this.
So this is recorded, I believe.
Yes, it is.
Yeah, so if I think if you can send us, Dan, all of us
Yes.
this link so that
Link.
all of us were in our own capacity can forward it to people who are listening to this, because a
Yes,
lot of
thank you so
questions will
much.
be similar to all the students, so they can even the question and answer area would be helpful for everyone. Hello, Dandan?
Yeah, I'm doing.
Yeah, there's somebody asking how many intakes per year. Just now, a new question has come.
Okay, what is it?
Akhilesh Arjun.
Hmm?
Only one intake in September.
There's only
right?
one intake per year, so it starts September, finishes mid-May.
Yes, and the program is with hands-on. It's not just observership. Somebody is
No, it's
also asking.
hands-on. So you'll not be a primary operator because you can't do that without the full GMC registration, and unless you're in a training scheme. But yes, you'll be assisting, and a lot of us have learned a lot from assisting. How many applicants? If you're applying, don't worry, we'll have seat for you if you're applying. How do I contact Mr. Michael? So, Michael, could you please put your email address if appropriate on the chat? But you need to first apply for the course, and then Michael will be able to help you. Post MCH already cleared MRCs. Can I get into? You'll need to go through the specialist training scheme or a Caesar route to be able to apply for an NHS consultant. But yes, that is the right route you're trying to do. One of the things people forget is that they start working, but they don't have any research experience. They don't have a higher degree in UK, and that's where they get stuck. Because when you apply for a Caesar or you apply for your for an NHS consultant, you apply for specialty, you do not have that area ticked off, so you lose a lot of marks, and you can't get on the scheme. So most of the people who have gone into specialist schemes, mostly they have MCH from Dundee.
And Professor, I think almost all these people, they are also in touch with Quext, and we are regularly we are in touch with them, many
Okay.
of them. And my senior manager from our office, Zareen Mehta, she's also on this call right now.
Excellent. Thanks,
So
Naeem.
anything that they want to know, they can go through us as well. We will forward it to Michael or anybody within the university.
That's so many questions you answered, and I put our course information, and how in that course information you can see how to apply if you want to apply for this course, and if you are offer holders and you have non-academic questions, and you can contact international student at dundee.ac.uk with your name and student ID number. However, if you don't have the offer yet and you want to consult about course information, please contact the school. And the email is in our chat as well. I know some people is asking about Chevening scholarship, and the Chevening scholarship, I'm not 100% is available for this course, but you can have a look. I put the information, Chevening scholarship information is there as well.
Okay, so before we finish off, firstly, I would like to thank Dandan for the organizing this. Thank you, Dan, and thank you to Ravi and Vandana from Quest and their team, Zareen, and everybody who's managing all the affairs in India. And thank you to Michael and Rosemary for their help, because I think it's they keep me right. I can't be there everywhere, so thank you both of you, and a big thank you to Amna and Rahul for being our brand ambassadors. Thank you very much. And Rosalind is not here, so she's our administrator as well. So with that note, I think the few things I would think, if you are thinking about it, have a look around, ask questions, and make a decision soon, because everything takes time now. The checks in India, checks in UK are much stringent as compared to 5-10 years ago. They need a lot of documentation. Most of the people who have got stuck are for small sort of issues like bank information and things like that, and it just takes time. So I would start thinking about it. and start corresponding with us in terms of at least getting your application in, documents in, and then it helps us. Then Mike can at least advise you about the scholarships. We can advise you about accommodation, and that's all sorted so that you're not last minute rushing. You don't have your cast letter to apply for visa. You struck. The course has started. You don't have an accommodation, so we don't want that scenario, because we want you to have a nice experience in the course, because there's so much to do in the course. And if you're stuck with this, sorting out your accommodation or not being able to get your accommodation, that's not right. So we're here to help you as long as you make the contact. And thank you, everyone. Thank you for joining us on a Friday, because it's not easy for Fridays. Here it's the end of the week. Everybody has worked hard, and again there it's an end of the week as well for all of you working hard in India. So all the best. Thank you very much.
Good to see you all.
Thank you so much, Professor. It was a wonderful session. Thank you so much.
Okay, Dan, bye-bye. And if you just send us the link for this
Yes.
webinar, then we can forward it to everyone else. Okay.
I will do. Certainly.
Thank you.
Thank you. Bye now.
Great job
Bye.
done,
Have a
Dan.
good weekend. Bye.